In Port Harcourt, Nigeria, a community health insurance scheme is saving thousands of lives.
This scheme has wiped away our tears.
An emergency patient is rushed to Obio Hospital.
They do theater now to save your life.
Doctors help bring new life into the world.
Coming out. There.
And new moms receive support at home.
Taking care of twins and breastfeeding twins exclusively for 6 months is possible.
This healthcare revolution has the potential to spread throughout Nigeria and beyond. Across Africa, millions of people are without access to affordable healthcare. Thousands of lives are lost every single day to treatable illness. But in Port Harcourt, Nigeria, a partnership between Shell Petroleum Development Company joint venture, Rivers State Government, and a cluster of local communities has established an innovative community health insurance scheme. It's used by 45,000 people.
In Africa, and Nigeria is not different, women are literally dying to have babies. This kind of program has made it possible for them to have access to quality obstetric care. The health outcomes have been very good. For us, that's the main driver, that we've been able to provide a system of care that makes it possible for women to have their babies safely and affordably as well.
Affordable and sustainable. Those are the key things. Sustainable. When the healthcare is accessible, affordable, available, and sustainable, then you can scale it up to wherever. That is how it grows.
Obio Cottage Hospital is the scheme's flagship facility. It is best known for its maternity and childcare services. But the hospital caters for all, male, female, young, and old.
How are you? You're tired? Well done.
Chief Matron Dorothy Odujobi has worked at Obio for 17 years and has overseen many changes.
When I came, we had a lot of challenges. That people those days, they didn't understand, the vision. They didn't understand maybe that some people, have dream.
When Dorothy arrived, the hospital had just 2 beds. Today, it has 51. A modern, well-equipped operating theater, an emergency treatment room, and constant power thanks to on-site solar panels and wind turbines. It's Dorothy's job to make sure the hospital runs smoothly.
I don't want to see them coming like this, with their baby. Some left their baby at home and they are doing exclusive breastfeeding.
On the maternity ward, Professor Alfred Ehigiagba has an emergency on his hands. Comfort Mba is in labor, but after 16 hours, she's unable to deliver her baby without assistance.
I saw her, I examined her. I actually thought she would be able to deliver. She was fully dilated, the baby was ready to come out, but the baby's head was high. The labor was obstructed, and we took the decision that she would be sectioned.
An obstructed labor can deprive a baby of oxygen. This emergency cesarean section is potentially life-saving for mother and child.
Well, the cord is not around the baby's neck, so the baby is coming out. There. That's it.
All is not well. The baby boy shows signs of asphyxia, a lack of oxygen to the brain and other vital organs.
He's trying to cry now. Yes, we don't know what to do.
This infant will need careful monitoring. The surgery has cost $870. But Comfort will not have to pay. The operation is covered by the Community Health Insurance Scheme. as Professor Ehigiagba finishes surgery. On the children's ward, Professor Omobirale is on his morning round.
Events last night, madam, you know, the last temperature was 12 o'clock yesterday. So let's watch it for today, okay? So that we don't want a situation where we'll discharge you home this morning and you start rushing back.
The ward provides care for up to 10 children. At least one doctor is on duty or on call 24 hours a day, 7 days a week.
So we'll earmark her for discharge tomorrow. This one can go later today now. Temperature is normal.
Professor Omobirale promotes open and honest communication with patients through every step of their healthcare. He believes it can help speed recovery.
I've been telling my nurses and doctors that when you're managing a case, let the patients know at each stage of management what the scenario is so that they can be with you. You need to give antibiotics, you know, for between 4 to 6 weeks. So it's going to be a long time.
Effective communication is now at the heart of Obio's healthcare philosophy.
Are you happy this morning? 100%, we thank God. I can see that you are smiling. We are getting better. My business as a pediatrician, because I know what was happening, is to reassure her.
The success of the community health insurance scheme means patient numbers are rising. Professor Omobirale also trains Obio Cottage Hospital's doctors and nurses to ensure there are enough staff to provide a high-quality service.
Trying to bring Obio Cottage Hospital to such a standard that is comparable to secondary health facilities in states, Rivers State, and in Nigeria.
On average, 270 babies are born at Obio Cottage Hospital every month. 3 days ago, Rosalind Okoro gave birth to twins, Favor and Miracle, during a planned cesarean section. A procedure she was apprehensive about.
When the doctor told me I'm going to deliver my baby through cesarean operation, I was very, very scared. I was scared.
Are you okay?
Because I've had many stories. The chief matron was there. She told me that I should believe her. I'm coming out successful, and my babies and me will be alive.
Improved facilities mean the procedure has become routine in cases where mother or baby could be at risk from a natural birth. Rosalind has uterine fibroid that would have made a natural delivery dangerous, but the cesarean went without a hitch.
I'm very, very happy, and the staff, they are wonderful people. They are wonderful people.
Today, Rosalind's husband, Emmanuel, is on his way to collect his family and take them home.
I told one of my neighbors that my wife has delivered, but through CS. She shouted, "Where are you going to get the money? 100 plus." I told her not to worry, that everything has been taken care of.
As a member of the Community Health Insurance Scheme, Rosalind pays a 10,000 Naira annual subscription, about $55 US. All childbirth costs, most treatments and drugs are now free. Without insurance, Rosalind and Emmanuel would have faced a bill of over $1,000 US.
Where would I have gotten such money from? This scheme has, wiped away our tears. I don't know how to express, my gratitude. I don't know how to say this. I'm so, so happy.
Following its success at Obio, the Community Health Insurance Scheme is now running in 4 hospitals across Nigeria's Eastern Delta. Today, Chief Matron Erewari Owanda and her team are visiting the Mbodo Alu Township as part of a community outreach program.
Let me see how the place looks like.
Community uptake is key to planned further expansion, so signing up new members is a constant activity.
So now welcome. We are coming from Primary Health Center, Mbodo. This is a health worker. Now Peking too. This one another health worker. We have 2 doctors. 1 day maternity leave, 1 day on ground. He's one of it. Then this is now our lab scientists. We have our pharmacists, ID. Then we have the one where they do that thing where they call free scheme. Let me just introduce her. She's going to make that interpretation. She will tell you people, you know when you pay for 1 year, what are you saving? You are saving your money and saving your life. Life first, health is first. Is it not so? When you are healthy, you go get money and you go get wealthy. And the scheme, we want it to run more in this place.
It's Rachel Emmanuel's job to sign up new members. She hopes to encourage people here to join.
Good morning. This is the scheme that the earlier told you about. Anytime you're sick, go down to the health center, doctor will see and prescribe drugs for you free of charge. That's what we do. So if you're ready anytime at the health center, I also have the forms with me here, if you're ready now. No, men, women, children, everyone. Everyone, yes.
But community outreach is about more than just signing up new members. It's also a chance to provide free health care to those in most need.
When we go out for such outreaches, we offer consultation services, treatment, we offer counseling services, we bring drugs.
Today has been a success. The medical team has treated over 20 patients, and Rachel has signed 8 more people up to the scheme.
They tested the system. They found that we were through to our wards. And so the scheme has just taken a life of its own. So it's the beneficiaries now that are marketing the scheme. So when they come, they saw that it was good. They went to tell the other people as well.
This scheme is saving lives on a daily basis. And at Obio Cottage Hospital, doctors are on the front line right around the clock.
Time determines whether that woman lives or dies.
At Obio Cottage Hospital, a community insurance scheme is providing high-quality care to a growing number of beneficiaries. Dr. Umejego Chidozie has been a doctor at the busy hospital for 3 years. He was first drawn to the medical profession after a family tragedy.
I lost my brother. I wanted actually to be an engineer. But I saw when my elder brother died, a gunshot. And with the following that, I saw what happened in the hospital. To me, I was not convinced. I thought, oh, he should have made it. So that was when I took the decision to be a doctor.
At the hospital's front gates, an emergency patient is arriving by taxi. The young mother is slipping in and out of consciousness and is in a great deal of pain. Dr. Chidozie needs to respond quickly.
Seeing a nurse with a wheelchair going toward the taxi, so it struck me that this is an emergency. And I want to know what kind of emergency it is.
He's in female ward.
Dorcas Essien is accompanied by her infant son and sister, and neighbor and friend. Her lower abdomen has become severely swollen. Dr. Chidozie uses an ultrasound to find out why.
You were pregnant. You were pregnant, and now the baby was growing not inside the uterus, but in the right tube. So all these people then are blood, knife inside them. They go theater now to save your life.
The fetus is growing in Dorcas's fallopian tube rather than her womb. The condition is known as an ectopic pregnancy and can be life-threatening.
So we quickly rushed her to the theater. The good thing about it was there was no delay.
Dr. Chidozie thinks her swollen abdomen could be caused by internal bleeding.
Yes, morning, yeah. The first thing we saw was hemoperitoneum, with a lot of blood intra-abdominal.
The pregnancy has caused the fallopian tube to rupture, resulting in a huge hemorrhage. Dr. Chidozie needs to act fast. Dorcas will bleed to death unless he controls the blood loss.
I already prepared for auto-transfusion. So we collected about 1,700 ml of blood, and we retransfused into her.
The blood transfusion keeps Dorcas alive, while Dr. Chidozie clamps and ties the ruptured fallopian tube. After 30 minutes of surgery, he manages to stop the bleeding.
Time determines whether that woman lives or dies. So the timely intervention is what is needed in this case. And that is just what we did.
For now, Dorcas remains seriously ill.
But she's lucky to still be alive.
Life-saving emergency surgery is one aspect of the community health insurance scheme. Disease prevention is another. At the Mbodo Alu Health Center, Erewari Awanda runs free immunization sessions for members of the scheme.
Are you all sitting down? You don't have chairs? Bring more chairs, so that all these mothers can sit. Number 15, because of the poverty rate in Nigeria, where most people cannot afford to buy drugs. Most people cannot afford to give their children immunization. Here, we give them free.
Children are offered immunizations against tuberculosis, diphtheria, and 10 other life-threatening diseases.
Call the next number now.
Winning the trust of community leaders has been vital in spreading the message about the scheme. The local chief, Chief Nnorom, became a convert to community health insurance when he found himself in need.
After we had gone for about 3 times trying to encourage him to tell his people about the scheme, eventually I found him in the health facility. He came in with hypertension. He came in diabetic. So we had to admit him on bed, treated him. Now he's very strong. Now he knows the importance of the scheme. He now went back and he has gone back to tell his community members, so this scheme is very, very good. Though. People should come and embrace it.
If you just pay this meager amount of money, you will take an antenatal free of charge, delivery free of charge. They didn't believe it. But when other people started, going there and coming out and, blowing the trumpet, and people, started queuing into it.
Many people rely on traditional healers for their health care. So the team works hard to sway opinion in favor of modern medicine.
The challenges we face, coming to the facility to see the doctor is quite a little problem because we have a lot of chemists around. We have the traditional birth attendants who take deliveries. We try as much as possible to disabuse their minds, to make sure that they come in here to see the doctor before it is too late.
Back at Obio Hospital, on the maternity ward, Comfort Mba is recovering from an emergency cesarean section. Her son, Daniel, suffered a lack of oxygen during a difficult labor. Chief Matron Dorothy Odujobi has been monitoring him for 8 hours, and something's wrong.
Baby is learning, it's not used to eat.
Baby Daniel won't feed and is unresponsive. Dorothy refers him to the specialist children's ward for tests.
This mother, I'm sure they don't take the anti-malaria prophylactic religiously, because this baby was also found to have malaria.
Unknowingly, Comfort had passed malaria onto Daniel while he was in her womb. Sadly, his condition deteriorates.
It was like the child is lifeless. Fear gripped me. I was like, what is happening?
The baby was not responding to deep, painful stimuli, which made the baby was unconscious.
Baby Daniel has slipped into a coma. He is seriously ill and will receive anti-malarial treatment as doctors battle to save his life. Maternity care at OBO doesn't end when new mothers and their babies leave the hospital. Once discharged home, Visits Officer Deborah Oyewole is on hand to check on progress.
I want to know if the babies are fine. I want to check if they have taken their immunizations. I want to also know if she has come to do her follow-up post-natal visit.
Today, Deborah is visiting first-time mom, Believe Faithful, who gave birth to twin boys 6 weeks ago.
Afternoon, well done. Oh, how are we? Hey.
Welcome.
How are we doing?
We're fine.
Well done.
Welcome,
How have you been?
Fine, thank you.
As part of the Community Health Insurance Scheme, Believe attended antenatal classes at OBO Hospital.
What I learned from the nurses is that pregnancy is a normal process. Those things that sound and feel abnormal, they are normal processes of pregnancy. So your ability to enjoy it, you are also drilled to start having the understanding of what motherhood is like. For me, as a first-timer, I must tell you that if not the drilling I got during my antenatal period and the classes I attended and the way I was handled, I wouldn't have been the strong person you are seeing today.
So far, businesswoman Believe is taking motherhood in her stride.
Sorry, but it's been fun. You know, when you get counsel on how to cope with them, you see that you can actually have time for yourself. Taking care of twins and breastfeeding twins exclusively for 6 months is possible.
Some people, breastfeeding just one child is a big challenge for them, let alone 2 children. So when you come for immunization, we would really want you to tell the other mothers that it's possible.
Hi.
Well done.
At OBO Cottage Hospital, Comfort Mba's baby, Daniel, is recovering after 3 days in a coma. Doctors are confident he will make a full recovery.
So the baby is out of coma and the baby is crying, baby is sucking, and baby is breathing on his own, no more seizures. So we are just waiting, to complete the anti-malaria. And I'm sure Madam is happy. Okay, we thank God for you. This is your first baby. Very good. So at least you have a good tale to tell when you go home. You have your baby to take home. Okay, congratulations. All right.
I'm very, very happy, so excited. All thanks goes to the management of OBO Cottage. I'm so grateful.
Without insurance, Comfort and Daniel's life-saving care would cost around $1,300 US. But members of the Community Health Insurance Scheme can expect this level of care free of charge. After a massive internal hemorrhage, Dorcas Essien was left fighting for her life. 7 weeks later, she returns to the hospital with her young son for a checkup with Dr. Chiduzie.
You know how many blood will give you that day? And that blood will not be so we carry from outside though. 4 pints of blood now will remove from your belly, give you back.
Now I can walk. I can carry my baby. I can walk inside my house. So I thank God for doctor and nurse. With God, will keep my life. The doctor to save my life too.
Dorcas and Daniel Mba's recovery are just two of the many success stories at Obio Hospital. 45,000 people have joined this self-sustaining scheme and are benefiting from the wide-ranging healthcare it provides.
One of the main objectives of the program is to create a model of care that is not just sustainable, but that is scalable and replicable. And we've been able to do that.
Why are you looking at me like that?
You can see that if we can replicate whatever we are doing, this partnership has brought to bear at Obio in other health centers in the community. In the next few years, we will have our own health system that can take care of itself. Anytime we are called upon to say, look, this is the way to go. For healthcare in River State, this is the way to go. For Nigeria, this is the way to go for Africa.
The SPDC joint venture is proud to be associated with this accessible, affordable, and sustainable scheme that has the potential to revolutionize healthcare for millions of Africans.